If you're in perimenopause and your doctor has given you a contraceptive for treatment of perimenopause, listen to what my doctor friend said about that.
Contraception is not the best approach for treatment of perimenopause. There is some situations where you may partially rely on a contraception, but they are special sort of circumstances, like somebody actually needing contraception, so we can incorporate that in a part of the treatment, or somebody may have something like PMDD and they actually respond better to the synthetic hormone. So few examples, but as a general rule, I wouldn't say, well, be on a contraceptive pill, this will address your perimenopausal issues. Contraception is a hormonal disruptor by definition. So it's there to latch on to the receptors on your cells as a normal hormone would do, so the same receptors, but what it does on the inside of the cell is very different to a natural bioidentical hormone. So we cannot expect the contraception to address the perimenopausal issues. I see the perimenopausal symptoms as a sort of SOS signal that there is a shortage of hormones. The contraceptive pill is not going to fill that gap and address that shortage. It's not going to prevent dementia, it's not going to prevent heart disease, it's not going to prevent osteoporosis. In some situations, synthetic hormone can do exactly the opposite to what natural hormone will do. For example, natural progesterone builds bone. Synthetic progestin, in some cases, can actually weaken your bone. Probably the most extreme example of that is a Depo-Provera injection. That's an artificial, synthetic progestin. We know it thins bones. So we normally say, if you're on it for contraception, you should not be on it for more than 2 to 3 years. And even in that period of time, it can weaken your bones, but usually that's reversible, usually. There are ladies out there who maybe had problematic periods and nobody really addressed the underlying issue, could be endometriosis, could be something else, and allow them to be on Depo-Provera for 15 years plus, leading to osteoporosis at a younger age. So that's just one of the examples of how natural hormone will do very different thing to a contraceptive pill.